Children receive care in many different healthcare settings depending on their needs. An acute care hospital provides treatment for serious illnesses, injuries, surgeries, and emergencies. Extended or long-term care facilities provide ongoing care for children with chronic illnesses or complex medical needs. Urgent care centers treat non-life-threatening illnesses and injuries that require prompt attention, while outpatient clinics and provider offices focus on routine health maintenance, vaccinations, screenings, and management of chronic conditions. Some children receive care through outpatient surgery centers, where procedures are performed without an overnight hospital stay. Pediatric research centers help advance treatments and improve outcomes through clinical research. Finally, many children receive care in the home setting, where families provide daily care and home health nurses may assist with treatments, medications, and medical equipment. Preparing a child for a procedure requires the nurse to consider the child's developmental stage, cognitive abilities, and emotional needs. Children who understand what is happening are generally less anxious, more cooperative, and better able to cope with treatments and procedures. Nurses should use age-appropriate communication, involve parents when appropriate, and provide opportunities for questions and emotional support. For infants, parents are the primary source of comfort and security. The nurse should encourage parental presence whenever possible and have parents participate in comforting activities such as holding, rocking, feeding, talking, or providing a favorite blanket or toy. Procedures should be performed efficiently to minimize separation anxiety and distress. For toddlers and preschoolers, explanations should be simple, concrete, and given shortly before the procedure. For example, before a blood pressure measurement, the nurse might say, "This cuff will give your arm a gentle hug." Before a blood draw, the nurse can explain, "I am going to take a tiny bit of blood to help us see how your body is working." Toddlers appreciate limited choices that promote a sense of control, such as choosing which arm to use or selecting a bandage color. Distraction techniques include bubbles, music, videos, books, storytelling, light-up toys, or counting games. For the school-age child, explanations should be more detailed and honest. Children in this age group often enjoy handling equipment before it is used. For example, before using a stethoscope, pulse oximeter, or blood pressure cuff, the nurse may allow the child to examine the equipment or use it on a stuffed animal. Positive reinforcement is effective and may include stickers, certificates, small prizes, extra playtime, or praise for cooperation. For adolescents, privacy, independence, and involvement in decision-making are especially important. The nurse should provide privacy by knocking before entering, ensuring proper draping, and offering opportunities for confidential discussions. Adolescents should be included in treatment planning whenever possible and encouraged to ask questions. Appropriate coping techniques include deep breathing, guided imagery, listening to music, journaling, talking with trusted friends or family members, relaxation exercises, and participation in decision-making. A child's response to hospitalization varies greatly and is influenced by several important factors. Age and developmental stage play a major role in how children understand illness, hospitalization, and medical procedures. The amount of preparation provided before admission can significantly reduce anxiety and improve coping. Children who have a stable, secure home environment and strong family support often adjust more easily than children who have experienced instability or trauma. Previous hospital experiences also affect reactions. A positive experience may decrease anxiety, while a negative experience may increase fear. In addition, the support provided by nurses, healthcare providers, and family members can greatly influence a child's ability to cope. A child's overall emotional and mental health status should also be considered when planning care. Despite developmental differences, there are several stressors that affect children of all ages. Separation from parents and caregivers is often one of the greatest fears, especially for infants and young children. Pain associated with illness, treatments, or procedures can create significant anxiety and distress. Another common concern is fear of body intrusion, which includes fears related to injections, surgery, invasive procedures, loss of body function, or changes in appearance. Nurses can help reduce these stresses through family-centered care, developmentally appropriate preparation, pain management, therapeutic play, and honest communication. Children may display stress differently depending on their age. Infants may cry excessively or have feeding disturbances. Toddlers may become clingy, resist care, or regress in developmental skills. School-age children often worry about missing school and losing control, while adolescents may be particularly concerned about privacy, body image, and separation from peers. Recognizing these age-specific reactions helps nurses provide individualized emotional support. Hospitalization can be a stressful experience for children and may trigger emotional and behavioral responses that nurses should recognize and address. 3 common responses include separation anxiety, fear, and regression. Separation anxiety typically begins around 6 months of age when infants develop object permanence and realize that parents continue to exist even when out of sight. Separation anxiety is usually most intense in toddlers, who have limited understanding of time and may believe their parents are not returning. Children experiencing separation anxiety often progress through 3 stages. During the protest stage, the child cries, screams, searches for parents, and resists comfort from others. During the despair stage, the child becomes withdrawn, quiet, sad, and less interested in play or interaction. During the detachment or denial stage, the child may appear adjusted and begin interacting with others. However, this is often a protective coping mechanism rather than true adaptation. Family presence, rooming in, familiar objects, and consistent caregivers help reduce separation anxiety. Fear is another common reaction to illness and hospitalization. Children may fear pain, injury, loss of control, bodily harm, or unfamiliar procedures. Intrusive procedures such as injections, intravenous catheter insertions, blood draws, and surgery are particularly frightening. Hospitalization may disrupt a child's sense of trust and security and can threaten self-esteem, especially when activity restrictions or dependence on others are required. Nurses can reduce fear by providing honest explanations, using developmentally appropriate language, encouraging parental involvement, and offering choices whenever possible. Regression refers to a temporary return to behaviors associated with an earlier developmental stage. A previously toilet-trained child may begin having accidents, a school-age child may become more dependent on parents, or a toddler may resume thumb-sucking. Regression is a normal response to stress and should not be viewed as misbehavior. Nurses can help minimize regression by assessing the child's developmental level, maintaining normal routines whenever possible, encouraging age-appropriate activities, and providing praise and positive reinforcement as the child resumes appropriate developmental behaviors. Once the stress of hospitalization decreases, regressive behaviors typically resolve. When a child is hospitalized, parents often experience significant emotional stress. Their reactions may include fear, anxiety, sadness, guilt, anger, frustration, helplessness, or exhaustion. Parents may express these emotions through crying, irritability, withdrawal, frequent questioning, or changes in body language. It is important for nurses to recognize that these reactions are often normal responses to concern for their child's health and well-being. Parents bring their own life experiences, beliefs, and previous encounters with illness and healthcare into the hospitalization experience. Their reactions may be influenced by childhood experiences, previous hospitalizations, cultural beliefs, coping abilities, financial concerns, family responsibilities, and the severity of the child's condition. Some parents become highly involved in care, while others may appear withdrawn or overwhelmed. The pediatric nurse must demonstrate empathy, patience, acceptance, and therapeutic communication. Building a trusting relationship with parents helps reduce anxiety and promotes family-centered care. Nurses should encourage parents to express their concerns, ask questions, and participate in decision-making whenever appropriate. Active listening and validating emotions can help parents feel supported during a stressful time. Communication is one of the most important nursing interventions. Poor communication can increase fear, confusion, and mistrust. Providing clear, honest, and consistent information helps parents understand their child's condition, treatments, and expected outcomes. When parents feel informed and involved, they are better able to support their child and participate in care. Pain assessment and management are essential components of pediatric nursing care. One challenge in caring for children is that they may not always report pain accurately. Some children may avoid telling adults they are hurting because they fear that reporting pain will lead to an injection, procedure, or other unpleasant treatment. Nurses should create a trusting environment and reassure children that reporting pain helps the healthcare team make them feel better. Pain assessment must be developmentally appropriate. Infants cannot verbally describe pain, so nurses rely on behavioral pain scales and physiologic indicators. Common signs include changes in crying, facial expressions, body movements, sleep patterns, feeding behaviors, heart rate, and respiratory rate. Examples of commonly used infant pain scales include the FLACE scale, face, legs, activity, cry, consolability, and the neonatal infant pain scale, NIPS. In toddlers and young children, crying does not always indicate pain. Fear, anxiety, separation from parents, unfamiliar environments, or frustration may also cause crying. Therefore, nurses should assess the entire situation and consider developmental stage, emotional state, recent procedures, parental observations, and physical findings when evaluating pain. Effective pain management includes both pharmacologic and non-pharmacologic interventions. Non-pharmacologic techniques are particularly helpful because they give children a sense of control and can reduce anxiety. Examples include drawing, coloring, distraction with toys or videos, guided imagery, relaxation exercises, storytelling, music, therapeutic play, cognitive coping strategies, and massage. These interventions are often used alongside medications to improve comfort and reduce distress. Family involvement is also important. Parents often recognize subtle changes in their child's behavior that may indicate pain. Including parents in pain assessment and comfort measures can improve outcomes and decrease anxiety for both the child and family. Children are not simply small adults when it comes to medication administration. Their bodies absorb, distribute, metabolize, and eliminate medications differently, which affects both the effectiveness and safety of drug therapy. Pediatric nurses must understand these differences to ensure safe medication administration and effective pain management. Adequate pain control allows children to participate in activities, rest comfortably, interact with family members, and focus on healing. When pain is not adequately controlled, children often become preoccupied with discomfort and may focus on when the next dose of medication will be available. Poorly managed pain can also increase anxiety, interfere with sleep, delay recovery, and negatively affect the overall hospitalization experience. Research has shown that preventive pain control, also called around-the-clock pain management, is often more effective than waiting until pain becomes severe. Administering analgesics on a scheduled basis can maintain therapeutic drug levels, reduce pain fluctuations, and often require lower overall doses than attempting to treat severe pain after it occurs. In infants and young children, medication elimination may be slower because the liver and kidneys are not fully mature, particularly in newborns and premature infants. Immature liver enzyme systems can prolong drug metabolism, while immature kidney function can delay drug excretion. As a result, medications may remain in the body longer and increase the risk of adverse effects if dosing is not carefully adjusted. Pediatric medication dosages are typically based on weight in kilograms and sometimes body surface area. Nurses must carefully calculate dosages and consider developmental differences in absorption, distribution, metabolism, and clearance. Accurate weight-based dosing and independent dosage verification are critical components of pediatric medication safety. Conscious sedation, more accurately called moderate sedation, is commonly used in pediatric patients to reduce anxiety, discomfort, and movement during diagnostic or therapeutic procedures. The goal is to provide comfort while maintaining patient safety. During conscious sedation, medications are administered to decrease awareness and anxiety, but the patient retains protective airway reflexes, can maintain an open airway independently, and is able to respond to verbal commands or gentle physical stimulation. Because children can move quickly from moderate sedation to deep sedation, careful monitoring is essential. Before sedation, the nurse verifies informed consent, reviews allergies and medications, confirms NPO, nothing by mouth status, obtains baseline vital signs, and ensures emergency equipment and reversal agents are readily available. Continuous monitoring of airway, respiratory status, oxygen saturation, trough and heart rate, blood pressure, and level of consciousness is required throughout the procedure. Following the procedure, close observation continues until the child has safely recovered. A 1-to-1 nurse-to-patient ratio is maintained during recovery because airway compromise, respiratory depression, or cardiovascular instability may occur as medications wear off. The child should demonstrate stable vital signs, adequate hydration, intact protective reflexes, age-appropriate motor function, appropriate verbal responsiveness, and a return to baseline level of consciousness before discharge from recovery. Family education is also important. Parents should receive instructions regarding activity restrictions, supervision needs, possible side effects such as drowsiness or nausea, and when to seek medical attention after discharge. Every family enters the healthcare setting with unique cultural beliefs, values, traditions, and communication styles that influence how they respond to illness, hospitalization, procedures, and interactions with healthcare providers. Providing culturally sensitive care helps build trust, reduces anxiety, and improves patient and family outcomes. Nurses should recognize that behaviors that seem normal in one culture may be viewed differently in another. For example, expectations regarding personal space vary widely. Some cultures are comfortable with close physical proximity, while others prefer greater distance during conversations. Eye contact may be viewed as a sign of respect and attentiveness in some cultures, but in others, direct eye contact with authority figures may be considered disrespectful. Similarly, touch, such as a reassuring hand on the shoulder, may be welcomed by some families but uncomfortable or inappropriate for others. Facial expressions and nonverbal communication also vary. Smiling may indicate friendliness and comfort in some cultures, while in others it may be used to mask discomfort, embarrassment, or anxiety. The concept of focus can also differ, with some cultures emphasizing direct attention to one task or individual, while others place greater value on family involvement and group decision-making. The pediatric nurse should avoid making assumptions and instead use cultural humility, asking respectful questions about preferences and beliefs. Whenever possible, include family members in care planning, utilize qualified medical interpreters when language barriers exist, and adapt communication strategies to meet the family's needs. Understanding culturally acceptable behaviors promotes therapeutic relationships and supports family-centered care, which is a cornerstone of pediatric nursing. Hospitalization can be stressful not only for the child, but also for parents, siblings, and caregivers. One of the most important responsibilities of the pediatric nurse is to address the emotional needs of the entire family while providing safe, evidence-based care. Children often look to their parents for cues about how to react to unfamiliar situations. If parents appear calm and confident, children are more likely to feel secure. If parents appear frightened or anxious, the child's anxiety may increase. Nurses should encourage parents to remain as calm, honest, and matter-of-fact as possible when discussing hospitalization, procedures, or treatments. Families should be given accurate information and opportunities to ask questions. Supporting parents helps them become effective sources of comfort and reassurance for their child. When preparing children for procedures, information should be developmentally appropriate. Children should receive truthful explanations, but the amount and timing of information should match their developmental level. For example, toddlers and preschoolers benefit from simple explanations given shortly before a procedure, while school-age children and adolescents often need more detailed information and opportunities to ask questions. Providing excessive details that exceed the child's developmental understanding can increase fear and anxiety rather than reduce it. The nurse serves as an educator, advocate, caregiver, and emotional support person. Interventions may include therapeutic communication, play therapy, preparation for procedures, pain management, family education, and encouraging parental presence whenever possible. Family-centered care recognizes that parents are essential members of the healthcare team and should be included in planning and decision-making whenever appropriate. Hospitalization can be a challenging and frustrating experience for children of all ages. Children are removed from familiar surroundings, routines, family member, friends, and activities that help them feel safe and secure. The stress of illness, procedures, pain, and an unfamiliar environment can increase anxiety and affect emotional well-being. One of the greatest challenges for hospitalized children is separation from their parents or primary caregivers. Children often depend on their parents for comfort, security, and emotional support. When that support is limited, children may experience fear, loneliness, anxiety, or separation distress. This is especially true for infants and toddlers who may not understand why their parents are not constantly present. Hospitalization frequently disrupts normal daily routines such as sleeping, eating, playtime, school attendance, and family interactions. Maintaining as much normalcy as possible helps reduce stress and promotes coping. Nurses can support normal growth and development by encouraging age-appropriate play, learning activities, mobility, and social interaction whenever medically appropriate. An important nursing goal is to support the parent-child attachment relationship while promoting healthy growth and development. Family-centered care encourages parental involvement in decision-making, caregiving activities, and comforting the child during procedures whenever possible. Parents should be viewed as partners in care rather than visitors. Open or flexible visitation policies help maintain family involvement and reduce separation anxiety. In addition, consistency in caregivers helps children develop trust and security. Seeing familiar nurses and healthcare team members can decrease fear and improve cooperation with care. Adolescents are at a developmental stage where they are capable of abstract thinking, problem solving, and understanding long-term consequences. Unlike younger children, adolescents can often comprehend the diagnosis, treatment plan, possible complications, and the impact that an illness may have on their daily lives, future goals, relationships, and independence. Because of this increased cognitive ability, they should be treated as active participants in their care whenever possible. Adolescents value autonomy and independence, making it important for nurses to involve them in decisions related to treatment, procedures, medication schedules, and self-care activities. Allowing adolescents to ask questions, express concerns, and participate in decision-making helps them feel respected and gives them a sense of control during what may be a stressful experience. Even when parents provide consent, adolescents should be included in discussions about their care and encouraged to provide assent whenever appropriate. Illness and hospitalization can threaten an adolescent's developing identity and self-esteem. Concerns about body image, peer relationships, school activities, sports participation, and social media connections may be just as important to them as concerns about the illness itself. Nurses should acknowledge these concerns and help adolescents develop healthy coping strategies. By recognizing adolescents' abilities and encouraging participation in their care, nurses help build confidence, self-efficacy, responsibility, and decision-making skills. These experiences can prepare adolescents to successfully manage their health as they transition into adulthood and become increasingly responsible for their own healthcare decisions. As children grow into adolescence, issues related to confidentiality, privacy, and legal rights become increasingly important. Establishing clear expectations about confidentiality early in the nurse-patient relationship helps build trust and encourages honest communication. Adolescents are more likely to discuss sensitive topics such as mental health concerns, substance use, sexual health, or risky behaviors when they understand how their information will be protected and when information must legally be shared for safety reasons. An emancipated minor is a person younger than 18 years of age who has been legally granted adult status. Depending on state law, emancipated minors may consent to their own medical treatment and make healthcare decisions without parental permission. Nurses must understand the legal rights of emancipated minors as well as other situations in which adolescents may consent to certain types of care. Because laws vary by state, nurses should be familiar with regulations regarding adolescent consent, confidentiality, reproductive health services, mental health treatment, substance use treatment, and mandatory reporting requirements. Understanding these laws helps protect both the patient and the nurse while ensuring ethical, legal care. Discharge planning should begin as soon as the child is admitted, not just on the day of discharge. Early planning allows the healthcare team to identify educational needs, equipment requirements, follow-up appointments, medication instructions, and community resources that may be needed after the child returns home. Families should receive clear written and verbal instructions regarding medications, treatments, warning signs that require medical attention, activity restrictions, dietary needs, and follow-up care. Nurses should use the teach-back method to verify understanding and ensure caregivers feel prepared to continue care at home. Parents should also be informed that children may demonstrate behavioral changes after hospitalization. Some children may experience temporary regression, clinginess, sleep disturbances, separation anxiety, irritability, or fear of healthcare providers. These reactions are often normal responses to stress and usually improve with reassurance, routine, and family support. Discharge planning is not only a clinical responsibility, but also a legal and ethical responsibility. Accurate and complete documentation demonstrates that appropriate discharge teaching, assessments, and follow-up instructions were provided before the child left the healthcare facility. In pediatric nursing, discharge documentation is especially important because children depend on parents or caregivers to carry out care at home. The discharge record should identify who accompanied the child home, including verification of the individual's identity when required by facility policy. Documentation should include the time of discharge, the child's overall condition, behavior, and readiness for discharge. This information provides evidence that the child was stable when leaving the facility. Nurses should also document the method of transportation, particularly when special equipment such as a car seat, wheelchair, or ambulance transport is required. The child's vital signs, weight, and physical assessment findings should be recorded when applicable to establish a baseline at discharge. Any medications, treatments, equipment, follow-up appointments, and home care instructions provided to parents or caregivers must be documented. It is also important to record that discharge teaching occurred and that caregivers demonstrated understanding, often through the teach-back method. Documentation should reflect questions asked, concerns addressed, and any educational materials provided. From an ethical perspective, nurses have a duty to ensure that families are adequately prepared to care for the child after discharge. Incomplete teaching or poor documentation can place the child at risk and may create legal liability for the healthcare team and facility. The admission process sets the foundation for safe, effective pediatric care. During admission, the nurse gathers important information, establishes a therapeutic relationship with the child and family, and ensures that all legal and safety requirements are met. Because children depend on parents or caregivers for support and decision-making, family involvement is a key component of pediatric admissions. One of the first responsibilities is verifying that informed consent has been obtained when required. The healthcare provider is responsible for explaining procedures, risks, benefits, and alternatives, while the nurse verifies that the appropriate person signed the consent form and witnesses the signature according to facility policy. The nurse should also ensure that questions have been answered before procedures are performed. Correct patient identification is critical for preventing errors. Identification bands should be applied and verified according to facility policy. Nurses should use at least 2 patient identifiers before administering medications, collecting specimens, performing treatments, or transporting the child. Safety is a major priority during admission. Pediatric nurses must implement essential safety measures, including appropriate crib and bed safety, fall prevention strategies, security systems to prevent infant abduction, medication safety practices, and age-appropriate environmental precautions. Families should be educated about safety expectations during hospitalization. Before procedures are performed, the nurse is responsible for ensuring that all necessary preparation steps have been completed. This may include obtaining consent, verifying orders, confirming allergies, reviewing laboratory results, providing developmentally appropriate education, and assessing the child's physical and emotional readiness. Children frequently require assistance with transporting, positioning, and occasionally therapeutic restraint use. Positioning should promote comfort, safety, and proper procedure performance. Any restraints used must follow facility policy, be the least restrictive option possible, and be used only when necessary to protect the child from injury or to safely complete a procedure. When caring for pediatric patients, nurses must gather accurate information while considering the child's developmental stage and ability to cooperate. Establishing trust with both the child and family is essential because parents and caregivers are often the primary source of information, especially for infants and young children. Basic data collection begins with obtaining a thorough health history. This includes the chief complaint, present illness, past medical history, birth history, developmental milestones, immunization status, allergies, medications, family history, and social history. Growth patterns, nutrition, sleep habits, elimination patterns, and school performance may also provide important clues about the child's health status. Nurses should communicate using age-appropriate language and encourage both the child and caregivers to participate in the interview whenever possible. The physical survey or physical assessment should be organized to minimize anxiety and maximize cooperation. For infants and young children, less invasive assessments should be performed first, saving potentially upsetting procedures such as examination of the ears, mouth, and throat until the end. Observation is a valuable assessment tool. The nurse should assess general appearance, respiratory effort, activity level, behavior, skin color, hydration status, growth measurements, and age-specific vital signs. Growth parameters such as weight, height, or length, head circumference, and body mass index are important indicators of pediatric health and development. Collecting specimens from children often requires creativity, patience, and family involvement. Blood, urine, stool, throat, and respiratory specimens may be needed for diagnostic testing. Proper identification and labeling are critical to prevent errors. Nurses should explain procedures using developmentally appropriate language, prepare the child and parents beforehand, and use comfort measures and distraction techniques to reduce fear and anxiety. Whenever possible, specimen collection should be performed efficiently to minimize stress and discomfort. Medication administration in pediatric patients is very different from medication administration in adults. Age is the most important factor influencing how a child responds to medications because the body systems responsible for processing drugs are still developing. As children grow, changes occur in absorption, metabolism, and excretion that affect how medications work and how long they remain in the body. Absorption refers to how a medication enters the bloodstream. In infants, gastric pH is higher, gastric emptying is slower, and intestinal motility is less predictable than in adults. These differences can alter the absorption of oral medications. In addition, infants and young children have thinner skin and increased skin permeability, which can lead to greater absorption of topical medications and an increased risk of toxicity. Metabolism occurs primarily in the liver. Newborns and young infants have immature liver enzyme systems, causing some medications to be metabolized more slowly. As a result, drugs may remain in the body longer and increase the risk of adverse effects. As children grow, liver function becomes more efficient, and medication metabolism begins to resemble that of adults. Excretion refers to the removal of medications from the body, primarily through the kidneys. Neonates have immature renal function, resulting in decreased clearance of many drugs. Because medications may accumulate more easily, careful dosing and monitoring are essential. Kidney function gradually improves during infancy and childhood, allowing for more effective drug elimination. For nurses, these physiological differences mean that pediatric medication dosages must be carefully calculated based on weight and developmental age, not simply adjusted from adult doses. Accurate weight measurements, careful monitoring for side effects, and adherence to medication safety guidelines are critical components of pediatric nursing care. Medication administration in pediatric patients requires extreme attention to detail because children are at a much greater risk for medication errors than adults. Small differences in dosage calculations can result in significant adverse effects. For this reason, the nurse must always calculate and verify the safe dose before administering any medication. Pediatric doses are typically based on the child's weight in kilograms, and many facilities require an independent double check by another nurse for high alert medications. A critical nursing responsibility is following the 6 rights of medication administration. These include the right patient, right drug, right dose, right time, right route, and right documentation. Before administering a medication, the nurse should verify the child's identity using approved identification methods and compare the medication order with the medication administration record. Parents may know their child's medications well, but identification procedures should never be skipped. The right dose is especially important in pediatrics. Nurses should compare the prescribed dose with recommended pediatric dosage ranges and clarify any questionable orders before administration. Because children have age-related differences in absorption, metabolism, and excretion, administering an incorrect dose can quickly lead to toxicity or inadequate treatment. The right route and right time are also essential. Some medications have specific administration requirements, such as being given with food, on an empty stomach, or at precise intervals to maintain therapeutic blood levels. Nurses should assess the child's ability to safely receive medications by the prescribed route and monitor for therapeutic effects and adverse reactions. Finally, right documentation ensures continuity of care and legal protection. Documentation should include the medication administered, dose, route, time, assessment findings, and the child's response. Ongoing monitoring after medication administration is a critical nursing responsibility because children may not always be able to communicate side effects or adverse reactions effectively. Starting and maintaining an intravenous IV line in a child requires careful planning because pediatric patients have unique developmental, emotional, and physiological needs. The nurse must consider not only the technical aspects of IV therapy, but also the child's age, level of understanding, and ability to cooperate during the procedure. Developmental characteristics are important because children respond differently to procedures based on their age. Infants and toddlers may fear separation and restraint, while school-age children often fear pain and loss of control. Adolescents may be concerned about privacy, body image, and independence. Understanding developmental stages helps the nurse provide appropriate preparation and support. The site selected for IV insertion should balance ease of access with the child's comfort and mobility. Common sites include veins in the hands, arms, feet, scalp veins in infants, and occasionally the antecubital area. The nurse should select the least restrictive site possible while preserving future venous access if ongoing therapy is anticipated. Proper preparation of the child helps reduce fear and anxiety. Explanations should be developmentally appropriate and honest. The nurse can use distraction techniques, therapeutic play, deep breathing exercises, videos, or comfort items to help the child cope during insertion. Family involvement is often beneficial. Parents can provide reassurance, assist with distraction, and help calm the child. However, the nurse should assess each parent's comfort level and determine whether their presence will help or increase the child's anxiety. Several related nursing actions are necessary to ensure successful IV therapy. These include verifying the order, selecting the appropriate catheter size, maintaining aseptic technique, monitoring infusion rates carefully, and assessing the IV site regularly for complications. Protection of the IV site is especially important because active children may accidentally dislodge the catheter. Protective dressings, arm boards, or securement devices may be used to stabilize the site while allowing visualization of the insertion area. Mobility considerations should be addressed to allow the child to continue age-appropriate activities whenever possible. Nurses should plan tubing placement and site selection to minimize restrictions while maintaining safety. Finally, safety needs are a priority. Pediatric patients are at higher risk for fluid overload, infiltration, extravasation, and medication errors. Infusion pumps, frequent assessments, accurate intake and output measurements, and weight-based calculations are essential components of safe pediatric IV therapy. Pediatric nurses frequently care for children who require assistance with nutrition, digestion, and elimination. Some children are unable to eat normally because of prematurity, congenital abnormalities, neurological disorders, gastrointestinal conditions, or severe illness. Nurses must understand specialized feeding and elimination procedures to provide safe and effective care. Gavage feeding is the administration of nutrition through a tube passed into the stomach, typically through the nose or mouth. It is commonly used for premature infants or children who cannot safely coordinate sucking, swallowing, and breathing. Before administering a feeding, the nurse verifies tube placement according to facility policy, assesses for feeding tolerance, administers the feeding at the prescribed rate, and monitors for complications such as aspiration, abdominal distension, vomiting, or respiratory distress. A gastrostomy is a surgically created opening into the stomach that allows long-term enteral feeding through a gastrostomy tube, G-tube. Gastrostomy feedings may be administered as bolus feedings or continuous feedings using a pump. Nursing care includes maintaining skin integrity around the insertion site, monitoring for infection, ensuring tube patency, providing proper nutrition and hydration, and teaching caregivers how to safely manage the device at home. An enema involves the installation of fluid into the rectum to promote evacuation of stool. Enemas may be used to relieve constipation, prepare for diagnostic procedures, or cleanse the bowel before surgery. Pediatric enemas require careful attention to the type and amount of solution used because children are more susceptible to fluid and electrolyte imbalances. Nurses should provide privacy, explain the procedure in age-appropriate language, monitor for discomfort, and observe the child's response. Because nutrition and elimination are essential for growth and development, nurses must carefully assess feeding patterns, hydration status, bowel function, weight gain, and overall nutritional status. Family education is also important to ensure safe continuation of care after discharge. Respiratory problems can become serious quickly in children because their airways are smaller and they have less respiratory reserve than adults. Tracheostomy care focuses on maintaining a patent airway, preventing infection, and keeping emergency equipment available at the bedside. Suctioning should be performed only when indicated by visible secretions, coarse breath sounds, increased work of breathing, or decreased oxygen saturation. Potential complications include hypoxia, infection, bleeding, accidental decannulation, and airway obstruction. Nurses should monitor for tachypnea, nasal flaring, retractions, grunting, stridor, wheezing, cyanosis, and decreased oxygen saturation, which may indicate respiratory distress. Oxygen therapy may be delivered through a nasal cannula, mask, oxygen hood, or tracheostomy collar. Continuous assessment is essential to evaluate the child's response. Airway obstruction is a pediatric emergency. Prompt recognition and intervention are critical to prevent respiratory failure. Children need age-appropriate physical and psychological preparation before surgery. Explanations should be simple, honest, and tailored to the child's developmental level. The nurse should encourage questions and correct any misconceptions, such as believing surgery is a punishment. Parents play an important role in reducing anxiety by remaining calm and providing reassurance. Maintaining familiar routines and comfort items can also help decrease stress. Children must follow prescribed nothing by mouth (NPO) guidelines before surgery to reduce the risk of aspiration during anesthesia. For infants, prolonged fasting should be avoided whenever possible. Offering a pacifier can help meet the infant's developmental need for sucking and provide comfort while awaiting surgery. Post-operative nursing care focuses on helping the child recover safely while minimizing both physical and emotional complications. The nurse closely monitors airway, breathing, circulation, vital signs, pain level, surgical site condition, and signs of bleeding or infection. Children may awaken frightened, confused, or restless after anesthesia, so providing reassurance and allowing parental presence whenever possible can help reduce anxiety. Pain management is a priority. The nurse should assess pain using age-appropriate pain scales and provide prescribed medications and non-pharmacologic comfort measures. Encouraging deep breathing, early movement as appropriate, adequate hydration, and gradual return to normal activities promotes recovery and prevents complications. Family-centered care remains important during the post-operative period. Parents should receive clear instructions about what to expect during recovery, signs of complications to report, and how to care for the child after discharge. Many families use complementary and alternative therapies, CAT, as part of their child's health care. Complementary therapies are used along with conventional medical treatments, while alternative therapies are used in place of conventional treatments. Nurses should ask families about any therapies they are using because some may interact with prescribed medications or affect treatment outcomes. Examples include massage, guided imagery, relaxation techniques, music therapy, acupuncture, herbal products, and meditation. Some complementary therapies can help reduce pain, anxiety, stress, and nausea in pediatric patients. The nurse's role is to remain respectful of cultural and family preferences while ensuring that all therapies are safe and coordinated with the child's medical plan of care. As nurses, it is important to understand that many families use complementary and alternative medicine, CAM, as part of their healthcare practices. The nurse's role is not to judge these practices, but to provide safe, evidence-based care while respecting the family's cultural beliefs, values, and preferences. Cultural competence involves recognizing and respecting health practices that may differ from our own. Families may use herbal remedies, traditional healing practices, spiritual rituals, acupuncture, massage, or other CAM therapies. Building a trusting relationship encourages families to openly discuss these therapies, allowing the healthcare team to provide coordinated and safe care. Nurses should assess and document all CAM therapies being used because some may interact with prescribed medications or medical treatments. For example, certain herbal supplements can affect blood clotting, blood pressure, blood glucose levels, or the metabolism of medications. Knowing about CAM use helps prevent adverse effects and improves patient safety. The nurse should also understand the basic principles behind common CAM therapies and be prepared to educate families using current evidence. While some therapies have demonstrated benefits for pain relief, stress reduction, nausea management, and relaxation, others may have limited scientific support. Nurses should help families distinguish between therapies that may safely complement treatment and those that could delay or interfere with necessary medical care. Effective nursing care involves integrating respect for cultural beliefs with advocacy for the child's health and safety. Open communication, cultural sensitivity, and patient education allow nurses to support family-centered care while promoting the best possible outcomes for pediatric patients. While some complementary and alternative medicine, CAM, therapies may be helpful, they can also pose risks. Herbal supplements can interact with prescription medications, affect blood glucose levels, alter heart medications, and change how drugs are absorbed or metabolized. Nurses should always ask families about the use of herbal remedies, vitamins, and supplements because these products may not be reported unless specifically discussed. Combining multiple medications and herbal products, known as polypharmacy, can increase the risk of adverse effects and drug interactions. Several types of complementary and alternative medicine, CAM, are commonly used by families during patient care. Acupuncture and acupressure use stimulation of specific body points to help relieve pain, nausea, and stress. Aromatherapy uses essential oils to promote relaxation and improve well-being. Hypnotherapy uses guided concentration and relaxation to help manage pain, anxiety, or unwanted behaviors. Chiropractic care focuses on spinal alignment and musculoskeletal health. Homeopathy uses highly diluted substances intended to stimulate the body's healing response. Herbal remedies, plant-based products used to treat symptoms or promote health, may interact with medications. Many families use herbal remedies to treat common childhood conditions, such as colds, stomach upset, anxiety, or attention difficulties. While some herbs may have potential benefits, many have not been thoroughly studied in children, and safety information is often limited. Common herbal products used in pediatric populations include chamomile for relaxation, ginger for nausea, echinacea for cold symptoms, and fish oil supplements for general health. Other products listed, such as ginseng, ginkgo biloba, feverfew ephedra, and blue-green algae, may carry risks or interact with medications. Because herbal products are not regulated as strictly as prescription medications, product strength and purity can vary. Some herbs may cause allergic reactions, affect blood clotting, alter blood glucose levels, or interact with prescription medications. The nurse should always ask parents about the use of herbal remedies and dietary supplements during medication reconciliation and educate families to discuss these products with their healthcare provider before use.